Hi everyone, my name is Dinesh Sirasena, and today we're going to be talking about imaging the anterior elbow. As with previous talks, I recommend two resources. First of all, the ESSR guidelines on musculoskeletal imaging, and also the website ultrasoundcases.info. So here's the images from the ESSR guidelines, and the first part is to image the anterior aspect of the elbow. It's useful to have the elbow resting on something like a cushion, just to give a bit more stability, and have the arm in a supinated position to expose the anterior elbow. With the hand in the supinated position, you can place the transducer transversely across the forearm. This will give you a short axis view of many of the structures running through the arm. And here we have the image. So the structures that we see here are the brachialis muscle, the pronator teres, the cartilage of the humerus. We can see the biceps tendon, and we can see the median nerve sitting adjacent to the brachial artery. If we change the orientation into a long axis view, what we're hoping to see is the biceps tendon, and you can see as it dives down onto the radial tuberosity. Other structures that we can see here are the brachialis again, the anterior fat pad, the humeral capitellum, the radial head, and also the supinator muscle. So it's very hard to see the biceps tendon in its entirety. And sometimes what we need to try and do is to hyperextend the elbow if possible, so that it brings the tendon as straight and as superficial as possible. Here are some more detailed images of the anterior elbow. Image A has the transducer in a long axis view, and again we're seeing the brachialis, the anterior fat pad, and the cartilage sitting over the humeral capitellum. In the transverse plane, again, we can see the brachialis. We can see the cartilage over the humeral capitellum and trochlea. And finally, we can see the tendon of the brachialis muscle. In practice, when scanning the patient, you can either have them sitting up with the arm resting on the examination couch, or what is more practical and also more comfortable for the patient is often to have them lying supine, with the arm in a supine position and the anterior aspect of the elbow exposed. It's a lot more comfortable for them, and you can also get much more stable images because there's less movement of the elbow. Thank you for watching. I hope you found the video useful and it adds to your knowledge of musculoskeletal ultrasound and how you can use it in your clinical practice. If you did, please remember to hit the like down below and follow the channel for further updates. You can also follow me on Twitter and Instagram, and please remember to check out sportsmedinfo.sg. I hope to see you all very soon. Take care.